Hello, everyone. I'm Associate Professor Chrissy Fediara of the Griffith University School of Medicine in the Gold Coast, Australia. I'm also the president and founder of the OCI Foundation, an NGO registered in both Nigeria and Australia. And it's also the same NGO that's behind the ArOY Youth Health Campaign, an OCI Foundation's initiative for Nigerian youth in the fight against breast and cervical cancers. We've been going through a number of modules to help prepare Nigerian teachers in senior secondary schools as they prepare to roll out the ArOY Youth Health Campaign across all senior secondary schools in Nigeria. This particular module talks about cervical cancer and what to teach about them. So in the past modules, we've talked about how to teach, who to teach, and when to teach. Now we're talking about what to teach. We've already talked about what to teach for breast cancers. This is about what to teach for cervical cancers. It's very important that we pay attention because it empowers our teachers to know what to teach and how to put it in the curriculum and in their teaching schemes. A bit of an outline here, we're going to look at cervical cancer teachings on different levels: general knowledge, risk factors, symptoms, screening, the HPV, that's the human papilloma virus, and the prevention. So there are 6 aspects of this to be included. Unlike in breast cancer, there were 5 aspects. This has 6 aspects, and every single one of them must be in the teaching, which, as we've talked about in the previous modules, should be included in about the 3rd or 4th week. You alternate that with the breast cancer and will be repeated. So if your 45-minute teaching does not include all aspects that I've mentioned, all 6 aspects, then it is not complete. This is very important for us to understand. This module is designed to help us get through and know exactly what to include for each aspect. There will be a trial quiz at the end of this, and this quiz is not designed to find out who is the most intelligent. It's only designed to make sure that you've engaged with this program, that you understood what has been taught and know what to do. It's very easy. And even if you fail it, you can always do it again and master what you're supposed to know. It's compulsory to do these quizzes before you get the certificate, particularly for teachers in senior secondary schools and for Nigerian youth corps who intend to join the teaching force as they get deployed to their places of primary assignments. What to teach, the notes. Just a few things to keep in mind here. All 45 minutes of the cervical cancer teachings must cover all aspects, all the 6 aspects, which includes the general knowledge on cervical cancers, the knowledge of the risk factors, knowledge on the symptoms, knowledge of the screening and pap smears, knowledge of vaccinations and HPV, and knowledge of preventive practices. So all 6 aspects must be included in the 45-minute teaching. We recommend about 5 minutes for each, and then that's 25 minutes, or that's 30 minutes. And then you round up in 5 minutes and allow 10 minutes for questions. That should be fine. That's it. Okay. Now, this 45 minutes is different for the 45 minutes for breast cancer, which has its own. Together, breast and cervical cancer has 90 minutes, split into 2 different sessions in 2 different weeks. Now, with general knowledge, what do we need the students to know about cervical cancer? Now, they need to know what the cervix is. It's the part of the female reproductive organ. Simple. It's also called the neck of the womb, and it's the part that connects the lower part of that womb to the top of the vagina. We've been shown in the introductory part on the facts, so if you refer back to that module, you see what I mean. And it's also in the textbook, the ArOY Youth Health Campaign textbook. So everything being taught here is in that textbook. On the risk factors, again, things we need the students to know: that early onset of unprotected sexual activities can increases the risk of contracting the HPV. Having multiple sexual partners, so we advocate having one partner if you must, but also avoiding unprotected sexual activities, particularly in the early stages of their life before they turn 18. Having many babies, so more than 4 babies increases the risk. So keeping the baby numbers as, keeping it within 4 or more, at most 4. Having STD, sexually transmitted infections, is also another risk factor. And then engaging in premarital sexual intercourse. So we normally, it helps to wait till marriage or wait till after 18, as these things will increase the risk. Lack of regular cervical cancer screening test is equally another risk factor. So we encourage, once you're of age, to start undergoing these cervical cancer screenings. There are a few other facts. See the cervical cancer facts, a different module that's been presented already. But if you scroll up through in the modules, you'll see it. And also the textbooks in your libraries would also be fine to look it up. So the teachers should encourage the students to check those textbooks. Symptoms of cervical cancer. So the students also need to be taught that early symptoms and what the early symptoms are and what the subsequent symptoms can be in advanced cases. For early symptoms, there may be no symptoms, and this is usually the case. Usually in early cervical cancers, there are no symptoms. And one way to get around this is to do cervical cancer screening tests. So the students need to know if you are waiting till you have a discharge or have a lump and stuff like that, it may be too late. Now, when symptoms do occur, it could be just irregular intermenstrual bleeding or abnormal vaginal bleeding. It's important. Some women do have irregular bleeding anyway, but if that's not your pattern and it changes, please see your doctor. There could be other causes. That's why it's important you see your doctor and not just assume. Bleeding after sexual intercourse is not common. It could be from trauma, but also could be a symptom of cervical cancer. Then feeling tired, weight loss, and loss of appetite, and then vaginal discomfort or discharge from the vagina. This could be from other reasons, but it could also be signs of cervical cancer. So see your doctor if you notice any of this. There are other facts, but you need to check the cervical cancer facts module to get this, or look up your textbook. Screening is another aspect that must be included in the teachings. It can be through one of three different techniques. Very important we make sure the students understand this. It could be through pap smears, it could be through cytologies, or it could be through HPV testing. Now, they don't need to memorize this. All they need to know is that these screenings are there. If they talk to their doctor, they will be told. But the pap smear is the common ones in Nigeria. The other two are not very common. And those, for a matter of fact, the OCI Foundation is offering some of these screenings free or at very subsidized cost. So check us out, contact us, check our website, Google us, you'll find the place to go if you want OCI Foundation to do this for you. Now, note that pap smear is the most common method in Nigeria. It can help detect early cervical cancers. In developed countries, it can start from 2 years after the onset of intercourse, or above from the age of 18, 20, whichever is later. In Nigeria, it is recommended for sexually active women, at times from the age of 30, but we recommend from the age of 20. The OCI Foundation recommends the same criteria as in the developed countries. And remember, we offer this service at highly subsidized cost and free for most of the Nigerian women. Contact us now. Once started, the screening should be repeated every 2 years. So it is not a one-off. I've seen a lot of women that have done cervical cancer screening. It turns out to be 5 years before. That's too late. You need to get this done every 2 years until Nigeria introduces the 5-yearly ones. So the HPV is another area that must be covered. The students need to know what it is, not in detail. We just want to keep it simple. It is called human papilloma virus in full. It is sexually transmissible, so they need to know that if one remains a virgin, not that we are saying everyone should be, but just to put it in context, then the chances of picking up this virus is very unlikely. But then you have to practice safe sex anyway. And this usually happens at the very first sexual activity, particularly if the woman is still very young, usually under 18. So that's the point I've just made. Now, preventable by avoiding sexual intercourse or practicing safe sex, use condoms. This virus is responsible for nearly all cases of cervical cancers. And it can also be transmitted by non-penetrative sex. So it doesn't have to be penetrative sex. Some skin-to-skin genital contact can equally transmit this virus. Infections from this virus can take 15 to 20 years before they develop into full-blown cancers. So that's one important thing. So people who get the virus does not automatically have the cancer. It may take 15 to 20 years, particularly if these individuals have very strong immunity. But for those with lowered immunity, like those with HIV or with cancer or with long-term steroids, or who don't eat well, it can take as little as 5 to 10 years to develop into immunosuppression, to develop into cancer. So this is important, and this is what everyone should know. It can also cause other cancers like anus or vulva or vagina or penis or the throat. But some of these cancers some of the viruses doing that are different, but we need to know this. Our focus is on cervical cancers though. It can also cause other diseases that are not cancers in the genitalia, in the nose, in the mouth, or in the lungs. We need to just keep this in mind, but our focus is on the cancer that it causes. Now, on the preventive practice, which is the last part of this, what to teach on cervical cancers. A number of preventive practices already you would have guessed from what we've taught already, but relevant vaccinations. So vaccinations available for women from the ages of 9 to 13 in developed countries. In Nigeria, talk to your doctor and find out the protocol. But vaccinations can prevent up to 80% of cancer deaths. Male circumcision, so circumcising the boys will help prevent them from transmitting this to the females. Using condoms, this for those who already engage in sexual activity, can be protective. Adopting lifestyle modifications, again, we've talked about these things, avoiding smoking, avoiding alcohol and stuff like that. Now, some notes on the vaccinations. It helps protect against the cancers. It is highly recommended by the WHO. It is safe and it is effective. So if anyone tells you otherwise, that is not correct. We advocate this for everyone. It is recommended for boys, like I told you, with girls from ages of 9 to 13. To be effective, it should be given before the very first sexual exposure, very first sexual activity. So this is it. This is important. Thank you very much for listening to this presentation. It is brief, but we need to make sure every teacher understands how to teach this. Let us join hands to arm our youths, to arm them while they are young, to arm them, all of them, and to do so right now. We can do this for our families, we can do this for our states, and we can do this for our country, Nigeria. Thank you.